161. Patients who have overdosed and have altered mental status are best transported. A. Supine. B. Prone. C. Left lateral recumbent. D. Full Fowlers. Answer: C. Patients with an altered mental status, especially those who have overdosed, should be transported in the left lateral recumbent position to prevent airway obstruction and allow for passive drainage in case of vomiting. 162. At a mass casualty incident, MCI, which sector should the incident commander establish first? A. Triage sector. B. Treatment sector. C. Supply sector. D. Transportation sector. Answer: A. The triage sector should be established first to prioritize and categorize patients based on the severity of their conditions before treatment can be effectively provided. 163. Which sector officer will coordinate with police to block streets and provide access at an MCI? A. Triage officer. B. Transportation officer. C. Supply officer. D. Staging officer. Answer: D. The staging officer is responsible for coordinating with police to ensure access for emergency vehicles and maintaining a log of available units at the scene. 164. What is the purpose of the START method? A. To coordinate the efforts of multiple response units to an MCI. B. To ensure safe access of responding units to the MCI site. C. To rapidly triage large numbers of patients quickly and efficiently. D. To communicate with medical personnel as efficiently as possible. Answer: C. The START, Simple Triage and Rapid Treatment method is designed to quickly and efficiently triage large numbers of patients in a mass casualty incident. 165. The first step in triage at an MCI is to. Answer: A. The first step is to direct the walking wounded to a safe location where they can be reassessed, allowing responders to focus on those who are more critically injured. 166. The three primary parameters assessed when using the START triage system are: A. Airway, breathing, and circulation, ABC. B. Respiration, perfusion, mentation, RPM. C. Appearance, respiration, mentation, ARM. D. Pulse, perfusion, perspiration, PPP. Answer: B. The START triage system assesses respiration, perfusion, and mentation, RPM, to quickly determine the severity of each patient's condition. 167. Continual re-experiencing of a traumatic event is a characteristic of which of the following? A. An anxiety disorder. B. Stress and burnout. C. Cumulative stress reaction. D. Delayed stress reaction. Answer: D. Delayed stress reaction, often referred to as post-traumatic stress disorder, PTSD, is characterized by re-experiencing the traumatic event and other symptoms, such as diminished responsiveness to everyday life. 168. What communication system has the capability to send and receive voice and telemetry simultaneously? A. VHF. B. Multiplex. C. UHF. D. Duplex. Answer: B. A multiplex system can send and receive both voice and telemetry data simultaneously, making it useful in emergency communications. 169. Which of the following correctly describes pulsus paradoxus? A. An abnormal decrease in the systolic pressure during inspiration compared with expiration. B. An abnormal increase in the systolic pressure during inspiration compared with expiration. C. An abnormal decrease in pulse rate between the radial and carotid pulses during inspiration compared with expiration. D. An abnormal increase in pulse rate between the radial and carotid pulses during inspiration compared with expiration. Answer: A. Pulsus paradoxus is an abnormal decrease in systolic blood pressure of more than 10 to 15 millimeters of mercury during inspiration, commonly seen in conditions such as asthma, COPD, pericardial tamponade, and tension pneumothorax. 170. Ventilating a patient at 30 breaths per minute with a bag valve mask and high-flow oxygen may result in A. An increase in intracranial pressure. B. A decrease in the normal serum blood pH. C. Alkalizing the bloodstream. D. Production of a tension pneumothorax. Answer: C. Hyperventilation can lead to respiratory alkalosis, a condition where the blood becomes too alkaline due to the excessive removal of carbon dioxide. 171. You can reduce gastric distension during artificial ventilations by A. Pressing on the stomach during ventilations. B. Providing ventilations deep enough to cause chest rise only. C. Positioning the patient at a 15 degrees sideways incline during ventilations. D. Squeezing the bag valve mask quickly during ventilations. Answer: B. Providing ventilations just deep enough to cause chest rise helps to reduce the risk of air entering the stomach, thereby minimizing gastric distension. 172. To adequately ventilate a patient with a partial laryngectomy through a stoma, you should A. Use more pressure to produce adequate chest rise. B. Pinch the nose and close the mouth. C. Suction the stoma with a soft tip suction catheter first. D. Use a special bag valve mask designed to ventilate a stoma. Answer: B. For a patient with a partial laryngectomy, you need to close the mouth and nose to ensure that the air is directed through the stoma and into the lungs during ventilation. 173. Which patient is most likely to require immediate transport? A. 25-year-old male, fractured wrist. B. 45-year-old male, fractured pelvis. C. 38-year-old female, fractured tibia. D. 52-year-old female, fractured humerus. Answer: B. Patients with pelvic fractures are at high risk for significant blood loss and other complications, necessitating immediate transport. 174. What should you determine first in this situation? A. Whether the other crew is treating patients inside and needs your help. B. Whether this is a potential hazardous materials incident in progress. C. Whether the other crew has been overcome and needs your immediate assistance. D. Whether you need more oxygen and supplies than your ambulance carries. Answer: B. The first step should be to determine whether this is a hazardous materials incident, as this dictates the level of protection needed and the approach to the scene. 175. After you are instructed by the hazmat team to begin treating decontaminated patients, you should A. Take universal precautions and wear protective equipment. B. Begin your efforts with the least symptomatic patient first. C. Get ready to treat the patients as you would at any other scene. D. Thoroughly question the first patient for purposes of documentation. Answer: A. Universal precautions and appropriate protective equipment are essential when treating patients who have been exposed to hazardous materials, even after decontamination. 176. For which of the following procedures is a gown most necessary? A. Emergency childbirth. B. Drawing blood. C. Suctioning the airway. D. Cleaning instruments. Answer: A. A gown is most necessary during emergency childbirth due to the potential for significant exposure to bodily fluids. 177. Which of the following requires intermediate-level disinfection through the use of a solution of bleach and water? A. Routine housecleaning measures in your station and bunkroom. B. Any items that have come into contact with mucous membranes. C. Any instruments that were used in any invasive procedures. D. All items that have come into contact with intact skin. Answer: D. Instruments or items that have come into contact with intact skin require intermediate-level disinfection, which is typically achieved using a bleach and water solution. 178. Which infection is transmitted through contact with blood or body secretions? A. Hepatitis A. B. Hepatitis B. C. Varicella. D. Tuberculosis. Answer: B. Hepatitis B is a bloodborne disease that is transmitted through contact with blood or body secretions. 179. What is a major concern when dealing with a patient with organophosphate poisoning? A. Exposure of rescuers to the poison. B. Life-threatening dysrhythmias. C. Explosion or fire hazard. D. CVA or neurological effects. Answer: A. The major concern with organophosphate poisoning is the risk of exposure to rescuers, which necessitates proper isolation and decontamination procedures. 180. Which of the following medications is commonly used to treat patients who are victims of organophosphate poisoning? A. Adenosine. B. Atropine sulfate. C. Calcium chloride. D. Flumazenol. Answer: B. Atropine sulfate is commonly used to counteract the effects of cholinergic poisoning, such as that caused by organophosphates.